From the Times and the Sunday Times, this is The Story. I'm Jane Mulkerrins. For some, it's the most wonderful time of the year, of parties and merriment. But for others, a time of coughs, sneezes and fevers.
There's a concern among NHS bosses that we're facing a bit of a perfect storm over the next couple of weeks.
Flu season has come early this year, and the NHS is already under pressure.
The number of people in hospital with it is about twice as high as it usually is at this point of year.
For those who catch it, it is no walk in the park.
I was just absolutely exhausted, just a searing headache, aches, fevery aches up my back and my legs. I had a fever, so I was hot, cold and everything in between. I couldn't get comfortable. Lack of appetite, so I wasn't that hungry for the entire time, and just utterly exhausted. The exhaustion, I just wanted to sleep, and that's not like me at all. And everything was an effort. So it was just one horrible slog for 7 days. It was pretty awful, to be honest.
Health bosses are worried.
They're concerned that this is going to just keep climbing over Christmas and into the new year. And we could be seeing one of the worst flu seasons, in recent memory. And that's also being fueled by low vaccination rates, particularly among NHS staff, which means the flu has more people to spread to, has more people to infect.
And to top it off, resident doctors are striking for the next 5 days.
That means that it's the worst case scenario for them this Christmas. And winter is always the hardest time of year for the NHS, but to have a bad flu outbreak and strikes by thousands of doctors just makes it really, really tricky.
The Health Secretary and the BMA are at loggerheads.
It's a remarkable, I think actually unprecedented in the history of trade union relations in this country, for a trade union to have taken its members out on strike, having had a 28.9% pay rise.
And what we're saying is we need more doctors. What we don't need is a reshuffling of the deck chairs on what feels like increasingly feels like a sinking ship.
The story today: could the doctors' strike cause flu cases to rise?
Hi, my name's Eleanor Hayward and I'm the health editor at The Times. So every winter, tens of thousands of people get flu in the UK. That's normal and to be expected. Flu can be deadly, particularly for elderly patients and for young children. And so we usually see between about 7,000 and 20,000 deaths each winter in the UK with flu. And that all depends on how severe the outbreak is.
So tell us about this particular outbreak this winter, Eleanor. When did it start and how's it going so far?
The main sort of strange thing about this year's flu is that it started about 5 weeks earlier than usual. It doesn't usually kick off until kind of late November, December, the flu season. But this year we started getting warnings from health officials in October about unusually high number of cases for that time of year. And so when you look at the stats for things like the number of people in hospital with flu, they're, about twice as high as in recent years. And so the number of people in hospital with flu is currently at record levels for this time of year.
How many are we looking at right now in terms of hospitalisations?
There's nearly 3,000 people in hospital at the moment for the first week of December, and that's likely to keep on rising. Wes Streeting has warned that that number could triple by the peak of the outbreak. I think people are concerned that it seems to be spreading quite quickly and causing severe illness. So, there's a chance that this could be one of the worst outbreaks we've seen in recent years. What we've seen so far is that children are particularly badly affected. The health officials say that cases are highest among school children aged 5 to 14, and that this group currently have infection rates 3 times higher than in elderly patients. I mean, usually it kind of starts in children because it spreads through school and then transfers to adults a bit later on.
And we've seen some schools implement fire breaks already. That's pretty unusual, isn't it, to catch flu outbreaks?
Yeah, definitely. A couple of schools in November had to shut because so many children were off sick with flu and so many adults were as well, teachers, that they just couldn't keep open. They called it a fire break closure, aiming to limit the infection and do a deep clean of the schools, which is very unusual. It's, since COVID, we've not really heard of schools closing.
Tell us a little bit about this new variant, this H3N2. How does it differ to other flu outbreaks and strains?
So there are two main types of flu virus that dominate over the winters. One's called influenza A, H3N2, and another's called influenza B. Now, this year we've got influenza A, H3N2. And what's interesting about this year's virus is that it's mutated quite a lot since we previously had a big influenza A outbreak. And the drifted version, it's called, has been called subclade K. Experts said it's acquired about 7 genetic mutations since we last had a big H3N2 outbreak. And that means that people's previous immunity to this virus from maybe vaccinations or previous infections might not stand them in as good stead as it would have done if the virus hadn't mutated as much over the summer. It's normal for flu to mutate. That happens every year. It requires a few mutations, but I think this one is quite heavily mutated compared to previous versions of the virus that evolves naturally over time.
So aside from the fact that it might get round people's previous immunities, is it more severe in its symptoms as well, Eleanor?
In general, influenza A, which this is a strain of, causes more severe disease than influenza B, which is the other dominant type of flu. And because this year's outbreak is this strain, then people are expecting illness to be a bit more severe. But there's no suggestion that kind of symptoms are different or worse than we'd usually expect.
And Eleanor, how able is the NHS to prepare for outbreaks like this?
So the NHS has this problem every single year. I mean, they can't really say it's come as a surprise. And they do the same things every year, which is try and get people out of hospital to free up beds, try and ensure there's high vaccination rates. I mean, what's tricky is that, as we've seen from the headlines in recent years, the pressure on the NHS is just growing. I think all the latest data shows that A&E attendances, even before flu started, are the highest on record. So they've kind of got less wiggle room, which means when there is something like a flu outbreak, there's not much spare capacity in hospitals for an influx of patients. And I think that's why NHS bosses are really concerned about this winter.
So, Eleanor, if people are starting to feel a little bit unwell, what kind of symptoms should they be looking out for?
Yeah, I think it's always really tricky to tell if you've got a cold or flu. I had one last week and I think it was just a cold. But in general, people say that if you've got flu, then it comes on really suddenly. So you can kind of be fine one day, then wake up the next morning feeling like you can't get out of bed. And so flu, there's usually a really high fever, body aches, fatigue, whereas for a cold, it might just be a cough and a runny nose, which are really annoying, but don't necessarily stop you going about your day.
One person hit by this flu outbreak is Joshua Bratt.
I am Joshua Bratt, and I am a photojournalist working mainly as a freelancer for the Sunday Times and the Times.
And how old are you, Josh?
I was 38 last week.
Happy birthday.
Thank you very much.
Josh, do you consider yourself generally a pretty fit and healthy person?
I do, yeah. I work out 3 times a week at least. Do 5 10Ks quite regularly. And I also do jiu-jitsu as well. So, yeah, I'm quite an active person. So I like to think I eat healthy and exercise.
So tell us about your recent flu experience. When did it start and what were the symptoms?
So it started on a Wednesday afternoon, the 19th of November. And I was running for a train, as you do. And I got home and started to feel a little bit sort of tired. And I thought it must be from where I just hadn't warmed up and I sprinted for a train. But I started to get aches all over all down my legs and into my back area. And after about an hour, I started to feel quite unwell. So I said to my partner I was going to head off to bed, which was around 7 p.m, which is very early for me. I think she thought I was putting it on, to be fair. But I didn't eat my dinner, so she thought there could be potentially a bit of man flu going on. But
what did you think was going on at this point?
I thought I had like a cold coming on or something like that. I have to say I didn't expect it to go on to become the flu.
And then tell me about how the symptoms evolved. How were you feeling that night?
I went to bed. I fell asleep pretty quick, actually, which was quite unusual, being that it was so early. And then I came around 11 p.m. and yeah, I was not well. I was sweating. I had those classic fever chills where if you are wrapped up, you feel too hot, and as soon as you take the covers off, you start to shiver and feel really uncomfortable. So yeah, and then I started to have like fevery dreams and things. It was not very nice. And then the headache arrived, so it was like a triple whammy, really.
Describe the headache for me.
A constant. It stopped me concentrating. It was one of those headaches that you couldn't think about anything else, and it was only slightly relieved by a bit of paracetamol or ibuprofen. So yeah, it was not a nice cocktail of problems to have, I have to say.
At what point did your partner begin to take it seriously and realise this wasn't just a bit of man flu?
I think the next evening, when I had hardly eaten anything and I started to look quite unwell as well, so I lost a lot of colour, and just any little movement, even to go to the kitchen to get a drink, was like a massive mammoth task.
Did you take your temperature at all at home?
Yes, it was reading 40, I think the highest was 41.6.
41.6. I mean,
Yes,
anything
which-
over 38 is considered, a fever, a pretty
Yeah.
high fever.
Yeah.
It's 41.6.
Yeah, I actually took some pictures to send to a friend who's a medic, and yeah, I think they were quite shocked by that as well.
Yeah. So what was their response? Did anyone advise you to go to the doctor at that point?
Well, at that point, we were just taking my temperature, and it was only after a few days that we decided to speak to somebody. And then that's when they realised that I'd had a temperature like that for 3 days. So we were recommended to go into A&E. Reluctantly, I went into A&E on a Sunday.
And what symptoms were you exhibiting at this point?
They were all the same symptoms throughout. It was headache continuously, high temperatures, fever. I was having like fever dreams. I don't know if you've had the flu, you might know what I mean. It's where you constantly think you're awake, but you're actually asleep, and time seems to sort of speed up and slow down. Sounds extreme, but that's how I felt. And I was having sort of like a semi-allergic reaction to it as well, which the doctor later said was an over build-up of histamine in my body, which then made my eyes puffy and made me itch. And so it was a bit of a cocktail of.
And what advice were you given to try to deal with the symptoms?
To carry on drinking plenty of fluids, as many fluids as possible. Also trying to eat some obviously nutritious foods and things, and take regular ibuprofen and paracetamol every 4 hours, which I was doing. And I think because by that point my temperature had started to drop compared to the 2 previous days, I think he was confident that I was kind of on the mend or at the end of the flu. So I think he just said to go home and stay in bed. Yeah.
And how were your energy levels afterwards?
Not great. Up until about day 10, I felt very fatigued, quite tired. I could have happily slept all day and all night. And then, yeah, from Sunday onwards, I started to feel back a bit more myself, and I'm much better now. So, yeah, back to normal.
Josh, have you ever had a flu jab?
I haven't, because I didn't think that I needed one, but I would definitely consider it now, having had that, because it obviously lost a few days' work, and I missed my birthday, which I was meant to go away for. So there was a few things that I would have liked to have done over those days. So I would definitely have the flu jab again if it was offered to me.
But you wouldn't seek it out?
Next
winter.
winter, I would, yeah. I think I probably would, yeah. I think it's better to get it and not have the flu than to risk catching it again, isn't it?
So, Eleanor, we know that this year's strain is new and different. What does that mean for vaccinations?
So the good news is that the health officials have said the vaccination is pretty much what we'd expect anyway in terms of effectiveness. No vaccine is ever 100% effective for flu. The latest data we have shows that if you're an elderly person and you get a vaccine, then it reduces your chance of being admitted to hospital by about 70%. For children, it's a bit less effective. It reduces the chance of being hospitalised by about 40%. But overall, this shows that it is pretty effective at preventing severe illness and is definitely worth getting.
And how do they do that, Eleanor? Because they obviously have to create a different vaccine each year, depending on the variants and the strains. How do they do that? How do they know which strains to focus on each year?
Yeah, it's a bit of a guessing game because they obviously have to manufacture the vaccine quite a few months in advance of the flu outbreak. And one thing that drug companies, pharma companies do is look at what's been happening in Australia, where they obviously have their winter before we do. So usually the strain that circulates in Australia is similar to what we have. So that's always quite helpful. And then they'll look at things like what strain we had last season, and it's usually a slightly different one. And they usually try and cover a few bases in the vaccine, so protect against different strains, which means it is, in general, pretty effective.
So while it is effective, how are we doing in terms of numbers of people getting vaccinated at the moment?
It's quite interesting. About 30 million people in the UK are eligible for free vaccines on the NHS, but only about half of those so far have come forward to get their jabs, which is, I'd say, pretty poor. Less than half of NHS staff, so doctors, nurses, etc., have actually got their free flu jab. And obviously that's concerning because they could spread the virus to patients, and also because that then creates a problem of staff sickness, which leads to sick days, which adds to the pressure on the NHS. Among older adults, then it's about 72% so far have got the vaccine, which is quite good. If you're a younger adult with health problems, so maybe you're pregnant or have underlying health conditions, then you're also eligible for a free vaccine, but only about 40% of those have got it so far. And there's a real drive from the NHS to try and get jabs out to people this week so that they can be protected before Christmas.
Eleanor, why do we think these numbers are so low? Is it linked to anything to do with the vaccine scepticism, which has sort of been on the rise really since the pandemic?
Yeah, definitely. I think one term that gets used quite a lot is vaccine fatigue, where it's not necessarily people being massive anti-vaxxers. It's just people sort of saying, oh, well, I can't really be bothered. I'm not sure it's worth it. There's so many jabs these days. Why should I bother with this one? And I think particularly among NHS staff, that's what hospitals are reporting, that people just don't really think it's worth the effort. Before the pandemic, it was about 75% of NHS staff got their vaccine, and that's just steadily dropped off since. So last year, only 37% got vaccinated against flu. It's a bit better this year. It's 43% at the moment. But that's still, about half the level of before the pandemic, which is really concerning. And I think the reasons for that aren't fully understood. But obviously, vaccines became much more of an issue during the pandemic. And I think that's one of the long-term consequences of COVID that we're living with, is this rising vaccine scepticism in the rest of society.
And how much does it matter, Eleanor, if you only have, say, a 40% vaccine uptake with something like flu?
Vaccines are the only weapon we really have against flu. So getting that figure as high as you can is really important, both for limiting spread and for reducing the pressures on the NHS, reducing the level of ill health. I mean, flu can be really deadly. Thousands of people die from it every year. And so especially for those vulnerable groups, the children and elderly, getting the vaccine can be a lifesaver. And also, if you get it, even if you're not vulnerable to flu yourself, it could help limit the spread, which can protect other people around you.
And how easy is it to get a vaccine if you do want one? If you're not one of these groups that necessarily gets a free vaccine or, that's being called to come forward?
It's very easy. It costs about £20 from high street pharmacies. I think most of them do it. So some do walk-in appointments and some you can book online. But all the major high street chains like Boots, Superdrug, Lloyds and independent pharmacies as well do have flu jabs in stock.
So, Eleanor, we're recording this on Tuesday, and at present, the strike is going ahead. The resident doctors, who we used to call junior doctors, will have started a 5-day strike today. Why?
There's two issues. The first is pay. Doctors want a 26% pay rise. They say that can be over several years, but they say their pay has been cut since 2008 in real terms to the tune of 26%, and they want that back. There's also an issue of jobs. At the moment, resident doctors who've done their first 2 years in the NHS are struggling to get training places to become a consultant. And so sort of thousands are being faced with unemployment, which is obviously quite bizarre because the NHS is the ones who've trained them. And so that's a kind of separate ongoing dispute alongside the pay issue. And this 5-day strike is the 14th strike they've been on in the past 2 years. They've done 53 days in total.
Now, they have had one quite substantial pay rise already, haven't they?
Yeah, they've had the highest pay rise in the public sector for the past 2 years. In total, it's amounted to 28%. So it's far beyond what any other public sector workers have got. But the BMA are adamant that that's not enough and say Labour have to go further. And the government on their part are saying, well, there's no more money for you. So I think everyone's just kind of backed into a corner and it's hard to see a way through at the moment.
The government has offered them a deal, though, haven't they? What were the details of that?
Yeah, the deal that was offered to them last week, it addressed the jobs element of the dispute, but not the pay. There was about 4,000 more training places. And also Wes Streeting promised to pass emergency legislation that would have made sure that British doctors get priority for jobs over ones coming from overseas.
Eleanor, you mentioned this as part of a series of strikes that have gone on. How much support have these strikes had from within the union?
The strikes are very strongly supported by BMA members. A poll that came out yesterday showed that 83% of doctors voted to continue this week's strike. The BMA represents about half of all resident doctors in the NHS. So, it's hard to know what the doctors who aren't members of the BMA think. But I think certainly among BMA members, it's quite clear that the appetite for strikes is pretty much as strong as ever.
And what about from the general public? The government have been arguing that doctors have lost support of the public with this. How true do you think that is?
Yeah, it's definitely true. All polls by different polling companies show this gradual waning of support for strikes. I mean, when they first walked out, it was under the Conservative government about 2.5 years ago, and more than half of the public would support junior doctors. Now it's more than half oppose them, and I think it's only about 1/3 support this week's strike. And I think, with the strike in the run-up to Christmas at the time of this flu crisis, I don't think this is going to win them any more support from the public.
So how many doctors can we foresee striking every day for these 5 days?
Going off previous strikes, it's likely to be about 20,000 people walking out this week. So it starts at 7 a.m. on Wednesday and ends at 7 a.m. on Monday. And this is usually the busiest time of year for the NHS. So that's 20,000 doctors that hospitals can't really afford to lose. They really need all hands on deck at this time of year.
How do they even try to make up that shortfall, Eleanor? Can they?
Yeah, the thing that we see is consultants who are senior doctors, they get hired to cover shifts, and that usually means that hospitals have to pay hugely inflated rates to get consultants to cover night shifts and things for striking resident doctors. The NHS has been quite firm with hospitals that they shouldn't cancel routine care because of the strike. So it means hospitals are kind of trying to plough on as if nothing's happening this week. So the message to patients is, if you've got an appointment booked, you should go in regardless and carry on as normal, because the NHS is really trying to make sure that the strikes don't disrupt care.
And what has Wes Streeting said about the impact of this particular strike on patients and the NHS?
He's been very strongly worded about this strike being kind of the worst of all the strikes the BMA have ever done, because of the timing, because it's happening in this crucial period in the run-up to Christmas, and because it's coinciding with flu. Streeting said last week that this could be the kind of final straw. This could lead to a collapse of the NHS over Christmas. He's called the BMA dangerous, irresponsible, self-indulgent. He's not holding back.
The BMA have chosen to strike this week, not only to cause maximum impact and damage to the NHS, but choosing to do so at a time when there is the maximum risk to patients. I think that is irresponsible, and I think it's dangerous.
The government are saying that, lives will be put at risk by this. It's the worst possible time of year. They tried to get the BMA to delay the strike until January to just let the NHS, operate as normal until Christmas, and the BMA said no. And Wes Streeting was furious that they did that, saying it's a complete disregard for patient safety.
I mean, aside from the trade union dispute on this, does he have a point? Given the rapid rise in flu cases, which we've discussed, and the low vaccination rates, and now this strike, can the NHS cope with it?
Yeah, I mean, I guess we'll find out this week. I think he does have a point. It is a much riskier time than usual to do strikes. I mean, what the BMA would say and have said in response is that every winter the NHS has a crisis. You know, we report on a winter crisis every year. Every year there's patients dying in corridors. Every year there's ambulances queuing outside A&E. So it's not fair for the government to try and blame all that on the BMA. But I think we're getting more data on flu cases and hospitalisations out at the end of the week. And, you know, if that does show a huge increase in the number of people in hospital with flu at the same time as the BMA strike is going on, then, you know, people will be saying to the BMA, ultimately, your doctors, your job is to protect people. And I think Streeting said yesterday that they were abandoning patients in their hour of greatest need. And I think, you know, we've seen public support falling. I think people might agree with that sentiment as well.
Eleanor, what can we all do to help ourselves at this point of pressure on the NHS? I carry masks with me in my pocket and my bag now, and hand sanitizer. I know it sounds like we're going back to the dark old days of COVID, but what else could we do to help ourselves this winter?
I think the obvious one is get a flu vaccine. And then it's just common sense. Wash hands. If you are coughing and spluttering, then don't go on public transport or to work Christmas parties. And also, you know, if you're feeling ill, it sounds obvious again, but don't go to visit elderly relatives over Christmas. You know, even if you might have to miss out on family gatherings. That's the strong public health advice. I think on masks, there's been some suggestion that people should wear masks on public transport and things like that. The government haven't ordered that or anything, but you know, the evidence shows it does help. If you've got a cough and cold and you have to get a train, then it does help to wear a mask to help limit the spread. But, you know, hopefully everyone manages to stay well over the next few weeks.
That was Eleanor Hayward, health editor at The Times. And you also heard from photographer Joshua Bratt. You can read more about the doctors' strike and the flu outbreak at thetimes.com with a subscription. The producers were Shabnam Grewal and Edward Drummond. The executive producer was Tim Walklade. And sound design and theme composition was by Mao Lassetto. Thanks for listening. We'll see you tomorrow.